Now, we've heard the word quango, and it's gone, but I don't think people at home, or many of us, know what that is. It's a...
You do, though, don't you?
It is a quasi-autonomous, non-governmental organisation. Caroline, NHS England has gone, it's a quango. What is a quango? What does this mean?
Well, governments of all persuasions sort of set up what they call these arm's-length bodies to regulate or oversee or advise on public policy matters. So NHS England is clearly around the NHS and provides the strategy and priorities and focus for our health service. But you've got other things like Ofwat that regulates water or Ofgem that regulates the energy sector, skills councils. The government has set up a few quangos since it's come into power. GB Energy is another one. But there's always
27,
in
fact.
So there's always under governments quite a sort of clearing of the house. And on this one, I think the feeling from Wes Streeting, the Secretary of State for Health, and I think he's got a point, is you've got sort of double running. You've got the Department of Health and Social Care doing work on this area of public policy, but you've also got NHS England. It's not quite getting rid of the functions, because what they're going to do is look at the head count for NHS England, the head count for the department, and cut it by half. So it's around 20,000 combined. It'll go down to 10,000, but oversight for politicians will be much closer on it.
What do we think, Zaba? Because I'm imagining that at the very least Wes Streeting and Keir Starmer would be wanting to frame the front page of the Daily Mail this morning. They've not had great front pages, have they? And this is an absolute singing headline for the government, for a government decision, which is enough of it in itself, but for this particular government decision, which will make them feel, right, we're getting it right.
Yeah, I mean, they'll love that headline. It's great for them. But it's interesting that the Mail says that it's going to be great for patients. Well, we don't actually know that yet, do we? Because this is just another reorganisation of an administrative exercise. How this is going to impact your service at the GP, how this is going to impact your service in NHS Trust. We don't actually know that this reorganisation is going to have the intended impact. So I would like to just reserve judgment before we say that this is amazing until we see what this is, because there's 9,000 people you're taking out of this of jobs that are providing important jobs, providing an important service to think about how we run our health system.
And it was David Cameron, under David Cameron's government, wasn't it, in 2012 that this was set up? The idea presumably being that in some way take the health service out of politics. That it's but you don't politicise something so essential.
Well, yeah, I mean, it's a nice idea, isn't it? But when it comes to big policy issues that the public care about, and the health service is probably the number one, you know, if things go wrong, they want politicians to be accountable. And we already have structures at a local level and regional level to provide some oversight. That's still going to continue. And then, of course, we've got the providers, and there's lots of regulations to keep them in check and bodies that inspect them. But I think this is about saying, what are the priorities? And there's been some double running, I think, where you've got, you know, and it's nothing against the individuals themselves, but you have got people working in NHS England, and some of their jobs are duplicated by people in the department as well. So I think if it streamlines that, and if some of the money that currently funds it goes out to the front line, that's a good idea.
But you can streamline it without abolishing the whole thing. My concern is...
Yeah, but Lansley wanted to remove it from politicians, thinking, oh, we won't get blamed. No, it will always come back to the politicians.
That's not what the Conservatives were talking about. It was about giving the NHS independence to be able to make good clinical choices without it being politicised.
But it's not worked.
But we don't... It's not... You can't just say, sweep away the entire thing and say it hasn't worked at all. If we're talking about duplication, you could streamline it. Look, the point is like any change in government, it just becomes a question of how does this actually change any of the outcomes for patients. It won't help you get a GP appointment any quicker. All it is people fighting over who's more in charge in Whitehall. What does it change?
Well, what it changes is, I think, a sense of urgency and focus. And the government's been clear. They want more prevention rather than just treatment. They want more services in the community. And they want
but how
technology.
does removing NHS England help with that? Because I suppose one of the concerns is that generally reorganisations of big organisations, particularly the NHS, hasn't got a great track record. And indeed, already this week, you know, those working in it were told it was going to go down by 50% on Monday. They thought that meant there was 50% of NHS England. Then it became apparent the whole thing was going... You know, just in the last 48 hours, there's been confusion. What does that mean, and how quickly will we see the change? Because it could just be another 4, 5, 6, 7 years of chaos.
Well, Jim Mackey, who's taken over from Amanda Pritchard as the chief exec of NHS England, I mean, yesterday he was laying out to chairs and chief execs of trusts around the country about what the priority is going to be going forward. So he will be working closely with the department. But actually, as I said, when you look at the combined headcount of NHS England, the department is around 20,000. What the government has said is they're going to consume, if you like, absorb NHS England's department, but the headcount will go down by 50%.
There's a lot of chat about management, right? But what people at home care about is, will waiting lists go down? Will I get to see my GP? And will politicians being in charge make a difference to me and my use of the NHS, especially those that need it? And how quickly? Yeah. And one of the problems is we've got NHS England, but there's NHS Wales and there's NHS Scotland. In Wales, where there is direct political control, I mean, the average length of a hospital stay in Wales is much higher in England, at 7 days, for instance, and it hasn't gone well there. So, you know, isn't this an example of virtue signalling saving money by cutting bureaucracy? But to each and every one of us, it doesn't really help.
But of course, outcomes are the most important factor of this, and devolution creates different outcomes. And I think that's part of what res treating is trying to do, is get the focus on some clear outcomes, like more GPs, like getting waiting times. And the truth is, since the government's been in, since July last year, the number of appointments have actually increased. Some of the waiting times have gone down. They set a target and they achieved it in 7 months. And I think that was political pressure on NHS England and the wider service to focus. And one of the conversations coming out of yesterday's discussion with NHS leaders is we know there's some fantastic practice within the health community. I think the question is why in one part of England trusts are doing really well to tackle waiting times, to tackle diabetes, to get cancer diagnosis happening quicker, and why it's not happening more. And I think what government want to do is focus in on, look, there's best practice, everyone should be adopting the best practice. And in some ways, that hasn't been the case under NHS England.
Is there any chance that in this reorganisation, doctors, indeed senior nurses, and people with medical qualifications who are doing the work might get more power? Because I don't think people at home necessarily think it doesn't really matter whether it's a politician or an administrator that's making the decisions. I actually want my GP to be able to organise things better. Yeah. I want the doctor who says this person needs an operation to have power to then make it happen. Do you know what I mean? And I haven't heard anything in this first announcement about that.
Well, they will do. And a few weeks ago, we were discussing, you know, changes for the GP contract and how they're quite pleased, actually, the GPs. They're going to get more freedoms to recruit more GPs, which was restricted to some extent before, and they're going to be able to do more of what they want to do. And likewise, part of the deal in this is actually allow the providers at the local level to do their job. And by that, I mean the clinicians to be able to make sure they can have more flexibilities to deliver the services their communities want.
Can I just say, though, this is exactly what was said at the beginning of the coalition government about what we would do in order to tackle it by creating independence in NHS England. And I think it's a terrible sweeping thing.
But it's independence at the local level that's more important.
Right. So if independence is more important at the local level, then why just abolish this quango and create this unnecessary more hurdles, basically, for administrators and create a lot of confusion and a lot of chaos? I don't think you're going to get the outcomes that you want if all you're doing is moving the deck chairs on the Titanic.
The jury's out on whether it's going to cause confusion or chaos or actually bring some focus in.
Every organisational... If you're taking 9,000 people out of an organisation, that is going to create chaos. And nowhere are we saying that this is the plan that's going to transfer NHS England into the health department. So you're cutting all these civil servants and then you're applying new pressure on civil servants to say, you now need to do this job, without even knowing whether they've got the skills to do that or not within Whitehall.
Hang on. The pressure is actually saying, where do we want to focus the autonomy and flexibility to make a difference? And that has to be at the community level, at the local level.
Right. So why is somebody in Whitehall then going to make that decision?
They're not going to make that decision.
But if they're setting the policy and it is another step away from the clinicians and NHS England...
Politicians set the policies, the regulations are in law. The question is do we over-process by having some of these quangos duplicate and stifle decision-making? And, you know, this is not taken away from some very talented people, including clinicians who work for NHS England. But I think it's fair to say, you know, the NHS has had more money, has had more staff than ever before, but productivity and outcomes are not as good as they should be. And what you hear at local level from doctors, from nurses and others is give us some more flexibility to do the job on the ground without having to constantly respond to sometimes over-processing in terms of filling in forms, doing data and everything else that stops them doing their job.
Just one thought before, I know we want to move on to other things, but I'm sure we're going to be talking about this all morning as well, is to both of you acknowledge that it's actually quite a brave move from West Streeting and Keir Starmer politically, because when you strip away a layer of bureaucracy, you also strip away a whole tranche of things to blame when it goes wrong. I mean, Sam, do you think it's quite brave to stand up and do this?
Or risky?
No, I think this is a technocrat's answer to something that is actually much more fundamental. And I think this is easy to say, oh, we're going to take this quango away. When I want to praise them, it'll be when there's been a change in the outcome.